I will repeat the questions that come in from the web zone. As Susan says, we're open for business. Let it fly. Questions? You already had your question. You don't get another one. You know the rules of my classes. Anybody else right now? Going once, twice? Okay, you get a question. Give that man a microphone.
Dr. Kim, the data that you presented suggests that these Alzheimer's patients would want their surrogates to decide on their behalf. But I recall reading another study that I think might have been yours that that those surrogates are unable to articulate or really understand what it is those patients would want. So what implications does that have on the legally authorized representative system as a whole?
My studies were with normal people, talking about what they would prefer for themselves and for, as a matter of societal perspective, what the policies ought to be. So our primary outcomes really were about engaging the public and making social policy. How do you inform that? So we were talking about not what they would prefer and then inferring what the policy should be, although that's quite relevant. I'm not sure which study you're referring to. You might be talking about a study that was done a long time ago where people called up spouses after their spouses were in the study and asked them, what did you think or how did you make the decision? What is interesting is that there have been multiple studies like that. Even though from a bioethical theory perspective, we tend to use terms like substituted judgment, best interest, and so forth. When we try to pin down and force our respondents to use those terms, people kind of refuse. They talk about what their own reasons. And I think that people are used to making these decisions for people who are already impaired. And I think that when we try to pin them down to answer questions in the way we want them to for these research purposes, it gets hard. Having said that, it's a novel situation for a lot of people. And that's why we advocate that as soon as people are diagnosed, for example, with Alzheimer's or being evaluated, this idea of a concurrent proxy where you can still have a conversation is a really important one.
Dr. Botkin. Where does the term lack of insight fit into this equation of determining someone's capacity to consent to participate in a psychiatric drug trial? What if they don't have an understanding of their own illness or an acceptance of their own diagnosis? How does that play into the capacity to consent?
Well, I think it speaks directly to some of the components that Scott had outlined in terms of what we look to as sort of subcategories of consent process and mental capacities that we would expect one to have in order to make a valid decision about participation in the trial. So, this is certainly an area in which I don't have any clinical experience, so I would defer to Scott here, but I would be quite concerned about enrolling individuals who have a basic lack of insight about their own disease, both in terms of participating in research initially, as well as being able to report adverse events and follow up with the protocol, et cetera.
Right down here in front. Mental status tests basically look at memory, and what you're talking about is imagination. Harder to test. Go ahead.
Scott, this is Barbara Beer. I'm Harvard and the Brigham and Women's Hospital. I had a sort of different read of the UN Enable Article 12, which I think spoke generally to people with disabilities and was really trying to make a positive statement about not depriving them of rights and inappropriately stripping them of rights simply because they have disability. Not speaking directly to informed consent or people with decision-making incapacity, and very consistent in the way it was outlined with SACHRP's recommendation of 2009. So I just
Can
thought...
I speak to that? Yeah.
What? I would love you to speak to that.
Let me just
Yes.
repeat the question for the web audience. The question has to do with whether the UN statement essentially rejected the concept of decision-making capacity protections for persons without consent capacity, or whether it was really concerned with the issue of ensuring their inclusion in the ability to consent to trials, rather than setting up protections that actually had the effect of excluding them.
Yes. So I think if you make a distinction between the articles themselves and the general, I think you can hear me, right?
Okay.
You can? Okay. If you make a distinction between the articles of the convention and the general comment specifically about, I don't know if are you talking about the general comment itself? Okay. Okay. So articles themselves, I'm 100% in agreement with you. I think it's very easy to read those in such a way that's consistent with actually a quite progressive and good framework, even for people with mental illness, mental disabilities. And I think that's right. However, I think it's really important to point out that the committee in charge of writing and interpreting that have issued what's called a general comment. That was, the final version was approved in 2014, in which they specifically condemn and call flawed mental capacity tests, the very kind of tests that we're talking about. And if there are multiple public comments prior to that draft, which really didn't change much from the original that much, in which many jurisdictions, many progressive advocates of disability advocates were extremely concerned about this total disregard of the fact that you can't do supported decision-making for people if their preferences themselves are completely affected by their mental illness, such that you really need deeper protection. That is completely and it's been a really deeply dismaying thing for psychiatrists trying to deal with this, especially for in some of the European countries that tend to take the convention more seriously. So if you look at the paper that I cite, I will explain.
Next question. Yeah, microphone there. Yeah, if we get the mic to the next person.
Hello, Tom Morgan from Novartis. What I notice is there's a strong focus on only one party to the contract, the research contract, the patient and their family. There's no discussion at all about the researcher or the sponsor or any other party to that. So how do you encourage researchers to study these vulnerable populations with high unmet need? Imagine, for example, that you were convinced that you had the perfect drug to help pregnant women prisoners with mental illness. Okay, how would you possibly go about implementing that kind of study?
All right.
Sounds
for
like
the
a
web
question for
audience, the question has to do with how do you work on the other side of the equation, that is not the decisionally impaired person, but rather how do you work on the side of the equation that pertains to the sponsors or pertains to the researcher themselves with regard to situating themselves with regard to the impaired subject, in this case an imprisoned pregnant woman with mental illness that is a mental illness that is affecting her capacity to consent. Pregnancy here is a specially protected form of vulnerability within the federal regs. I just want to clarify that. Pregnant women are not without decision-making capacity just because they're pregnant. Go ahead.
I think we're waiting each other out here.
Yeah.
Beyond my pay grade.
I only make a brief comment, because I certainly don't have a good answer here. And my guess is that it's not probably so much barriers at the investigator side for those clinicians who serve these types of patients. And this is sort of almost the orphan drug type of circumstance for certain extent. If you've got some small challenging segment of the population that has special needs, how do you serve those needs? And I think there are clinicians usually that are dedicated to the care of those kinds of folks. And so probably wouldn't anticipate necessarily a whole lot of barrier there. Maybe some barriers at the IRB level, making sure protections are adequate, but it seems to me much of that barrier might well be on the industry side if there's not a profitable market available to market to that segment of the population. I'm guessing that the sponsor's ability to come up with protocols to address that would probably be the most significant barrier in this domain. Although I'd be interested in your opinion too, coming from your industry experience.
We are going to move the discussion, not end the discussion because of the time constraint, and we're going to move it to the Grand Hall.